So there is a virus that causes almost all cases of cervical cancer, and almost all of us are exposed to it at some point in time. Let's talk about HPV, or human papillomavirus, and how we can prevent it and protect ourselves and others. Welcome back. This is another episode in our cervical cancer prevention series. This is the new school OBGYN. It matters where you get your information. With that being said, my name is Eric Schmidt, board certified OBGYN, minimally invasive gynecologic surgeon. Today we're talking about HPV and the HPV vaccine. Stay tuned. Let's do a quick recap on HPV before we get into the HPV vaccine. So HPV, it's a DNA virus, and it's transmitted through contact. And this can be skin or cutaneous things, and it can cause things like warts. It can affect us in our mouths and throats, but it can also, as we're going to talk about in most detail, it can affect the genital region and the cervix in women. Now, when I'm seeing a patient for the first time and I'm counseling them on HPV, I'm really trying to hit home a couple points, okay? And the first one is that it's extremely common. This is potentially present in almost all adults. 80, maybe even 90% of all adults at some point in their life encounter HPV. Again, it's spread through contact, specifically sexual contact, but it can be any form of sexual contact. It doesn't have to be penetrative intercourse to spread HPV. And a big reason why it's spread is because people don't know they have it. It's asymptomatic. And with a healthy immune system, often the body is potentially fighting this off in 1 or 2 years. There are over potentially 200 strains of the HPV virus also, but we've really identified a few that almost cause all of the cases of cervical cancer. And so we can watch them closely and look for those potential early changes that could potentially down the road, many years, lead to cervical cancer. And often this is where the HPV vaccine comes in, because we're able to realize that the strain 16 and 18 cause 70% of the cervical cancers. So that's why when the HPV vaccine was first released, this is what it contained, the immunity against the 16 and 18. But it's developed into multiple other forms, into the quadrivalent or the Gardasil with the 4 strains protection, and now with the Gardasil 9 protects against 9 strains that have the highest chance of potentially leading to those precancerous to cancerous changes. Let's get this out of the way first, since we're talking about vaccines. First question, is it safe? Absolutely. It is one of the most safe vaccines out there. It was very well studied, and of course, with media, it was potentially demonized early on in its development for a number of different reasons. You can probably search them, but it has been through a vigorous trials and vigorous research data and studying adverse reaction events. We have databases for all of that, and it is extremely safe. If you're a numbers person, let's talk numbers. The chance of something like anaphylaxis is 0.1 in 100,000 cases of all the doses that were received in the US. And that's over 300 million doses. People thought it might cause infertility. Studies are done. It does not. People thought it might cause things like MS or other neurologic disorders. Studies were done. Over 4 million people in Sweden were studied retroactively to see, and there was no association with the HPV virus in someone developing any of those diseases. All right, moving on. So, but it can cause some local reactions, and that can be something like often pain at the injection site. Now, HPV vaccine has been associated with maybe a little more tenderness, soreness in the next day or two afterwards, but it should not be a significant pain or disruption to you. Also, there can be redness in the area, and less commonly, less than 1% of the people that receive a dose of the vaccine may feel faint or lightheaded and dizzy, maybe some nausea. That's why after we give this vaccine, we want to watch the patient for potentially 15 minutes or so, just to make sure they don't have any of these very rare potential side effects. So let's answer the question, does it protect against all strains? No, we kind of talked about that. It really is having the most associated strains that can lead to the precancerous to cancerous changes, or we call it CIN2+ or 2 to 3 of the cervix. And so we talked about the most recent vaccine covers 9 of those strains. Who gets the HPV vaccine and when? Now, the HPV vaccine is actually, you can get it as early as 9 years old. Generally, the people are getting it around 11 or 12 years old. And now this is both boys and girls, both, because both people can carry the HPV virus. And so if they both get it, we're further decreasing the transmission of the HPV. And guys, let's do our job. Let's get this vaccine because it unfortunately does affect people with a cervix more. And so, but we can help decrease the spread if we all get vaccinated. Recent changes made over the last 5 to 6 years is that they actually approved the HPV vaccine for people over the age of 26. Again, the initial recommendations was from age 9 to 26, and now it is from that age, but extends up to 45 years old. And there can be a little difference too on who gets 2 doses of the vaccine and who gets 3. If someone is getting it before 15 years old, it showed that they have a better immune reaction. They're able to get the immunity faster. And so you only need 2 doses. So if someone's less than 15 years old, you get a dose, and then 6 to 12 months later, a second dose. And now if somebody is over the age of 15 and you're getting it for the first time, that's fine. But the recommendation is you get 3 doses. On the first day, 1 to 2 months later, and 6 months later. Big question, what happens if life happens and you just miss a dose and it's not in the appropriate time frame? Let's say you go 6 months or a year longer than you should. You actually just get your next dose. You don't have to worry about it. You don't have to start the series over again. You just get your next dose and you're good. What about this vaccine in pregnancy and lactation? Now, we currently don't recommend this vaccine in pregnancy, and that's just because of lack of safety data. And pregnancy, obviously, we want a lot of time least is best, and so we don't recommend it during pregnancy, but lactation is completely safe, and so someone can get their doses when they are breastfeeding. Let's go over some common questions that I've written down that I get often in clinic. Do condoms or barrier protection during sexual activity prevent the spread of HPV? Unfortunately, it does not. It does decrease the chances of spread, but there is still skin-to-skin contact of different areas, and so someone can still get HPV even if they're using barrier protection. We still encourage barrier protection. Often a question I get, and I think what patients think about is, well, if I'm diagnosed with HPV, do I have to avoid sexual contact with my partner? And that is generally kind of a very personal choice. I would say no, because number one, if you've been sexually active or had any sexual contact with that partner, you have likely swapped the HPV virus with them. Again, healthy immune system is going to likely get rid of this HPV vaccine for the both of you. And the last question we'll go over. If someone gets the HPV vaccine, perfect. Now, can you still get HPV? Yes, unfortunately. But the HPV vaccine is likely protecting you again against the worst strains. And again, there's potentially hundreds of strains of the HPV that we know of right now. Now, there's fewer that infect the cervix, but still there's a lot more strains that are out there than are contained in the vaccine. But the vaccine should be protecting you against the strains that are the worst. Now, if you guys won't mind, like, subscribe. I hate asking, but the YouTube algorithm fell off our channel. We were doing really good, had good momentum for getting the information out there. Things happened in life. I wasn't able to create videos because I had a little touch of cancer, had to have surgery, and then had a wedding. And so the YouTube algorithm said, oh no, we're not going to recommend your stuff anymore because you didn't post for a month. But we're back to posting regularly. So if you won't mind, like, subscribe, comment if you have any questions. We're all doing good here. Look to be talking soon. For pre-cervix